This meeting is being recorded. This meeting is being recorded.
Okay, so I'm Hannahlore. This is the Autism and LGBTQ plus webinar. So if there's any questions, I'll probably answer them at the end if people want to put them in the chat. So I'm Hannahlore. I'm a peer support practitioner at Autism Oxford. I'm also autistic and I identify as lesbian. So a few things we're going to cover today are the statistics on the overlap between autism and the LGBTQ plus community. We're going to talk about how this impacts the individual and how to support the individual both in education, home and clinically, and ways that we can adapt care to these individuals and how to be inclusive. So a little note about language. We use identity first language. There's lots of discussions around whether people with autism prefer autistic person rather than person with autism. We will end up using person, autistic person, but the same logic applies to individuals who either identify with a different gender or anything like that. So it's important to ask pronouns and use the terminology that the individual expressed they prefer, and it's okay to get it wrong, but that's why we ask, and it's important that recognition and effort are used. So a few facts, around 700,000 people may be autistic, or more than 1 in 100 in the population, although we do believe that's higher. Autism is a hidden disability, so you can't always tell if somebody is autistic. At least 1 in 3 autistic adults are experiencing severe mental health difficulties due to a lack of support. This has also gone up since the pandemic. 42% of women and girls with autism receive at least 1 misdiagnosis before securing an autism diagnosis, and that's quite common. And we'll go on to more facts about the autism and LGBTQ plus overlap, but autistic individuals are more likely to be LGBTQ plus. They're less likely to conform to gender stereotypes and less likely to engage in traditional relationship structures. So a few common needs of autistic people: communication. So this can be both verbal and non-verbal. It can affect your understanding of social cues, body language, eye contact, and facial expressions. Sensory issues, this can be hyper or hyposensitive. So some people seek out sensory input, whereas other people find that this might be overwhelming or painful. And interoception, which is understanding your body signals. So things like understanding if you need to go to the toilet or if you're hungry. Physical health, there are lots of comorbidities, physical comorbidities of autism. This can be things like allergies or hypermobility, hearing or visual impairments, gastrointestinal issues and genetic conditions. There are lots of psychological issues that also can come with autism. Things like anxiety and depression are quite common, and you're also more likely to experience trauma in childhood. Emotional issues, this can be understanding your own or other people's emotions, and this can make it quite hard to regulate emotions if you're not able to put those into words. And understanding neurotypicals, so this is just the social rules that nobody tends to talk about that can make it hard to understand everyone else. So the female presentation of autism, it's important to note that this isn't just for those who identify as female or anything like that. So it doesn't matter what your assigned gender was at birth, but the female presentation encompasses traits that are either different or the opposite of the traits we tend to see in the diagnostic criteria. So this is to ensure that we're making sure we diagnose everyone. Just because their traits might be a little bit different, we're not missing them out. So some common traits of the female presentation are enhanced empathy, picky eating, not playing cooperatively, so tend to play singularly or can almost come across as bossy, I suppose. They can get extremely attached to people. This is quite opposite to, say, boys with autism, who tend to be more attached to objects or things, whereas the female presentation tend to be more attached to people around them, tend to be more self-aware, understand their traits a little better, and how this affects them, but that doesn't make it any easier to change or adapt their behavior. They're more likely to mask or camouflage. That's something that we'll talk about a little bit more. Strong opinions and personalities. Again, this is where people tend to call young girls bossy or things like that. But this can be a autism trait. And harder to make or keep friends. That's quite common as well. So a few misinformation or stereotypes that people tend to think about with autism and relationships. Or people think that autistics lack the emotional intelligence to love somebody, and therefore we can't love somebody of any gender. Most people, or stereotypes that autistic are asexual or aromantic. We'll go on to that a little bit more again. Have learning disabilities and therefore intellectual delays that invalidate their ability to perceive the attraction they feel. Experience hypersensitivities that make romantic activities unfeasible, or like to collect labels. And there are a couple of things that are to counter these. So we tend to find actually that autistic people tend to be very like excellent lovers in terms of like emotions and things like that, often hopeless romantics. They're usually strongly aware of the attraction that we feel, and can be due to because we're hyper analytical and perceptive. Actually, we can be great with physical intimacy. A number of us are hypersensitive, but those who are hypersensitive, this can be used as an advantage in relationships with ourselves and partners. And in terms of collecting labels, we don't collect labels, we collect the truth. And this is to do with helping us understand our own identities. So a few things like of the impact on individuals of being autistic and LGBTQ+. So some people feel that this means you're part of two minority groups, and that they feel that they have to come out twice. But this is obviously personal experience as to whether you have these feelings or not. Being part of both groups can increase your chances of discrimination, prejudice, which again affects your mental health and well-being and quality of life, things like that. Many autistics doubt their LGBTQ+ identification because of their autism, and that's again to do with the understanding of your own emotions and your feelings and relationships in general. So sex education is already less accessible for those who like the same sex or are transgender, because sex education is mostly always geared towards heterosexuals. Sex can be more confusing to autistics as sex education doesn't talk about autism and sex social scripts for sex, how emotionally draining it can be even though you're having fun, or how firmly to say no if you don't want to. And this is a big thing within the autistic community, that we don't get that education as much as we need. In schools or just in life, there are words that people throw around that they don't care or understand what they mean or where they come from. And again, that affects people's mental health. And autistic individuals can find it harder or irritating if they are unable to find the conclusion to their sexuality right away. And again, that's to do with wanting not labels, but answers, and to understand their own identity. So camouflaging is something that's quite common in autism. It's more common with the female presentation, but actually camouflaging isn't specific to being autistic. Anyone can do it. And actually, if you're on the LGBTQ+, if you come under that, then you're more likely to do it anyway. But this is used as a survival tactic to avoid people detecting your true identity. So there are things like hiding your true self and imitating others and using this to blend in. So camouflaging covers things like masking, compensation, and assimilation. So masking is the hiding of traits, Compensation is finding ways around the difficulties, such as forced eye contact or learning certain small talk techniques. And then assimilation is things like copying and mimicking behaviours, or maybe picking up words or phrases from TV shows and films. So mental health. If you're autistic and in the LGBTQ plus community, it increases your likelihood of having mental health issues. It increases your likelihood of having things like depression and anxiety and trauma, like I mentioned. There are also conditions that you're more likely to be misdiagnosed with if you have autism, such as schizophrenia, OCD, ADHD, personality disorder, psychosis, and anxiety. And these are conditions you can have with autism, but they're not instead of, and they are separate conditions from autism. So to touch on a few facts around sexual orientation, about 70% of autistic individuals identify as non-heterosexual, compared to 30% of neurotypicals. 15 to 35% of autistic community identify as LGB, compared to 4.5% of the general population. And a more common study done, I think this was at Cambridge University, autistic males are 3.5 times more likely to identify as bisexual than neurotypical males, and autistic females are 3 times more likely to identify as homosexual than neurotypical females. And this can take longer for autistics to figure out their identity around sexuality and gender. So asexual and aromantic, this can be words that people don't necessarily understand. So a brief definition is that it describes the wide group of people who experience a lack of or varying or occasional experiences of romantic and or sexual attraction, including a lack of attraction. This doesn't mean people can't engage in sexual relationships or romantic relationships. That tends to be that if it fluctuates or they have to make connections with people first. So it's a bit different. So autistics are more likely to be asexual or aromantic. They're more likely, autistic women are more likely to be asexual than autistic men. And a study of 230 autistic adults, 30% indicated that they experienced sexual experiences as unpleasant. So gender diversity, transgender people are 3 to 6 times more likely to be autistic. Many autistics reject the binary female-male divide. And there's a few reasons for this, or maybe reasons for this. Again, there's not a lot of research done on this topic. But if gender is a social construct, then autistic people who are less aware of social norms are less likely to develop a typical gender identity. Many autistic people don't feel the need to engage in societal norms, and therefore, unless given a logical reason, and therefore, because gender isn't something that we can describe logically, that I think people are less likely to see the purpose in it, I suppose. We already view the world differently, and we tend to have more open minds around these things. So I think we often, again, we don't like these boxes, so we view things quite on a broader scale, and therefore we don't feel the need to fit into certain categories like this. So relationships can be quite difficult, and this is whether you're straight or part of the LGBTQ community. Relationships also just generally tend to be more difficult for autistics because a lot of relationships are non-verbal communication, which again is harder if you're autistic. So autistics are less likely to engage in traditional relationship structures. They're more likely to be poly, which is polyamorous, and that's to do with engaging in relationships with more than one person. But this is it's a thing that's spoken about, so it's not like cheating. It's discussed, and it's a consensual relationship between more than just 2 people. They're more likely to practice non-monogamy and kink. Autistic partners may need pressure, so not aggressive but firm and consistent. So while this is not typically what you think of as a tender romantic relationship, It may cause discomfort to be kissed or held gently. And there's a great article on Angel Sense, which is 12 things to know about dating someone with autism. And this covers some of these areas of how autistic people might engage in relationships differently. There is a need for effective sex education programs that assist in developing healthy sexual identities and relationships. Again, this is quite hard if you're autistic to understand, because a lot of relationships, like I said, are unspoken, and there are rules that you're supposed to follow, and that can be quite difficult, especially if it's not such a logical process, relationships. So there needs to be more discussion around the relationship side of autism and what you can do to engage somebody to help them understand relationships better, because they're not a straightforward thing for anyone. So there are also studies that have shown autistic people often feel emotions deeper and more intense, but this isn't necessarily noticed by others or by their partners, because many autistic people don't show their feelings in a typical way. They might seem, they're not necessarily as expressive. So sexual health, this is something obviously that is important no matter what category you fall under. There are certain things that, if you're a parent, would be useful, like preparing your child for the need to wash more often, or shaving and using deodorants. And it's important to explain how these things need to be done, and social rules determining why we do them. For example, explaining that deodorant is a preventative thing rather than put it on to mask the smell. That's something that has come up. You may need to be more specific and clearer when you're discussing sexual health, as it's easy for autistic people to take things quite literally, like I mentioned with the deodorant issue. So it's important not to assume that people know what sexual health means, and to discuss this with people and explain what it covers. As like I said, education around this isn't great, so it's important that you do your best if you're working, whether it's parents, clinical, or in education, to do your best to educate. And like I said, we need better education on sexual health, and not just for heterosexual relationships. It needs to be in general. There is another good page on the National Autistic Society about sex education that covers a lot, from periods to what's appropriate behaviour to things such as how to, like, sexual health and prevention of STIs and things like that. So a few things of how to support. So it's important to be patient, and it may take time for people who are autistic or LGBTQ+ to express how we need help, or how we feel. It's important to listen to the individual and to educate yourself if you do not understand. This is important. It's always better to ask questions than to assume you know the answer. We find that a lot within the autistic community, as well as other communities, that people tend to make assumptions based on one person they've met, and that's how they figure you should treat other autistic people or other people who, I don't know, identify as gay, things like that. Visual information is great for aiding processes of verbal information. So using pictures or social stories are a great way of helping people with autism to understand this. So this could be used in many different ways, whether that's in sex education in school, whether it's explaining, whether you're trying to explain to somebody the different areas of sexuality, whether it's in a clinical environment and you're trying to explain to somebody how a process might happen, things like that. Identity first language, again, like I said, autistic person instead of person with autism, because autism is a person. It's not an accessory, it's not something you have, it's someone you are. And again, use language that's affirming and accepting of all sexual orientations and gender identities. So there's a few ways to adapt care and education. And again, it's not widely talked about, and there's not a lot of education on it in general. But there needs to be specialized sex education programs for autistics that specifically address LGBTQIA issues. This is important because, like I said, autistic people don't necessarily understand certain social norms, or we take things literally and therefore we need to understand, we need things worded differently. And again, we just need more sex education around the LGBTQ plus community. Like I said, it's more geared towards heterosexuality, and that's obviously, that's why there's a lot of I think stigma around it still, and around the fact that even if you identify as gay or lesbian or anything, you don't necessarily know yourself how to enter relationships or be safe with another person, because we're not widely talked about. Autistic people have an increased risk of sexual victimization. Again, this isn't something that's known, and more education and awareness is needed around it, and needs to be in early education. So parents and teachers need to keep this in mind if they have autistic children, or if they have somebody who's who identifies under the LGBTQ plus label. Then it's important that that's spoken about, and that sexual victimization is something that we can try and educate individuals on to help prevent. Again, there's a tag there for Neurodivergent Insights. That's an Instagram page where they've spoken a lot about the importance of that. So clinicians who work in gender clinics may want to screen for autism. This is quite important. Or whether you work in any sort of section to do with health and LGBTQ plus, it might be useful to screen for autism, as we know that there's a high rate within the autistic community, and this would help to understand the link better, I suppose. It's important to understand that an autistic person is more likely to be LGBTQ plus, and then keep this in mind when providing care and support. So they might not recognise themselves that they are yet, and even if they don't, it's not something you need to discuss, but it's something maybe that would be useful to think about when providing care, and understand that actually there might be added things that you need to think about or discuss when talking about it. So state exactly what will happen and in what precise order. So explain when things start and end. So this is crucial in healthcare settings, to explain how processes work. Be very specific. I was given an example the other day of somebody who went to a doctor's and who was asked to then take their clothes off, and the doctor would come back in. But because they are also neurodivergent, when they were asked to take their clothes off, they took them all off. Right, and actually the doctor wanted them to leave their underwear on, but that wasn't specified. So things like that are really important, to be really specific about the kinds of things you're asking of people. When giving options, again, be clear on the choices and keep them concise. So too many choices can be overwhelming. Visual aids are also great for giving options or choices. Again, this is great in healthcare settings. Reducing language and being concise with what you ask. That's important, because the more words you add in, if those words aren't necessary, it can be confusing to understand what people mean. You may want to use social stories to explain visits to the doctor or nurse. And social stories, if people don't know what they are usually pictures and instructions of the processes of things. So this could be going into a new school, or how a doctor's visit is going to play out. And this just helps to ease anxiety before going into these things, and to understand what to expect. So maybe it's got a picture of the person you're going to see or the room you're going to be in, and all this helps to reduce anxiety and the unknown aspect around it, especially with autism. That's quite an important thing to do. So I've got some references of things that we covered in this. There are a few Instagram pages of people who have spoken generally about this topic, about being autistic and part of the LGBT plus community. There are a few websites and research, and for autistic teens and young adults, there's a couple links for people of where to find support. So the takeaway here is that we need better sex education that involves topics around autism and sex, and autism and LGBTQ plus topics. clinicians, it's important that maybe we start screening for things like autism if you're working with those who are LGBTQ+. And whether it's about autism or whether it's about the LGBTQ+ issues, it's always better to ask rather than assume how to help the individual. We like to say, if you've met one person with autism, you've only met one person with autism. A lot of people tend to like to stereotype, and if they've met someone, they think that everyone they meet with autism is going to have those same traits, and actually it can be a very vast difference between two people you meet. And it's always better just to ask what people prefer, whether that's to do with their pronouns or whether it's to do with what sort of care, if they like being touched or if they don't. That's important to ask. So yeah, if there are any questions, I can try and answer any. If not, then we've got other webinars, and I hope that this has been useful. So thank you for coming, and I hope that there are other webinars that people might like to hear from us, and I hope to build this webinar as well, because sadly there isn't a lot of information around it, but I'd like to find more and get more experiences from other people at some point too.
Yeah, thank you very much. So I don't think we have any questions coming through. So if there's anyone doing any questions, just stick them in. Otherwise, I think.
Yeah, that's good. Yeah, it's important that anyone working with anything that's related to autism or related to LGBTQ+ understand the link and understand that actually you're more likely to have somebody who is autistic if you're working in like the clinical side of the LGBTQ area, or whether you're working with the autism side, actually you're more likely to have people who are also identify with the LGBTQ+ community. So that's okay.
Brilliant. Thank you very much.
Thank you, everyone.
Thank you.